I received a phone call. I actually looked on my caller ID and noticed that the call was coming in from San Francisco, and it was Dr. Conti. And I was extremely excited to find out that I had won the award. In fact, I stopped everything that I was doing and, celebrated for the remainder of the day and ran around and told my boss, Dr. Wakefield.
The Wylie Fellowship is very important because it will provide her seed money that will help kickstart her entire academic career.
The goal of my research is to promote wound healing in diabetic patients. I look at the cells that are involved in healing the diabetic wounds and try to improve the function of those cells, because in diabetes, those cells are disordered and they do not function properly.
Kathy's research is really directed at looking at those small blood vessels that are so important during the wound repair processing. So her fundamental discoveries could have some very, very significant impact on not only on how we understand these wounds that fail to heal, but actually may provide a segue to develop therapy to help facilitate healing these wounds.
Diabetic wounds are the #1 cause of amputation, so they're a very significant health problem. So the goal of my research is really to find therapies and ways that we can improve these diabetic wounds so that these patients don't need to go on to amputation.
And this is very important because diabetes is so common in the country.
I think the advantage of us as translational scientists is because we are kind of on the front lines. We see these patients, we treat this disease, and then we can also take that back to the bench and try and design therapies based on what we see. I really feel like it's very important for the younger generation of surgeons like myself who are coming out into a world where there's not a lot of surgeon scientists. So I think a program like this is really critical in maintaining surgeons who do research.